I think initially the importance of the hit the ground crawling workshop to the young men won't be quite so apparent because it's something that is new to them. It may be the first time that anybody has asked them, what are you looking forward to about being a young dad? What do you feel about being a young dad? I think the importance of it is that they'll learn the basic skills and the basic pitfalls of being a father. And one of the good things with the group is that it's run by people who've got experience of working with children, but have also got experience of working with young fathers. Within this DVD you'll find information from people about cot death, you'll find information about meningitis, you'll get bits of information about breastfeeding and the benefits of that for your child. Hit the Ground Crawling is a workshop for first-time fathers to be. It gives you a chance to talk about becoming a dad with lads similar to you in a relaxed group. You can share your concerns or offer your advice and learn new skills to help you for when your child is born. Here are some young dads from a previous workshop and what they have to say about their experience at Hit the Ground Crawling.
Just thought I wanted to leave really because I was that nervous, and then when you get to know the people in there it's alright when you think about it, because they're alright lads and that. You get on with them fine and you can like give them advice and they can help you give advice as well. So it's alright when you get there, when you think about it.
Just go, give it a go. If you don't like it, you can always walk away, but you might like it. It's a nice little, it's not that many people, it's only a handful of people.
I'd recommend the workshop and the Hit the Ground Crawling to any young dad, any father, any young dad that's going to have a baby, because the best thing that he ever done.
Very good. It's educational and tells you things that you don't really know about babies. So I didn't know really that much until I come here and what to expect and things like that. So it's very good.
I'd tell you other young fathers to come along to the workshop to find out some of the information, because it's dead interesting, like, and it helps you out a lot.
The skills that I learned from the workshop was all about like cot deaths, like how to position the baby right in the cot, put the baby in the bottom of the cot so the blanket doesn't go over the head. Learned how to change a bottle, so the bottle might be not infected and might not harm the baby, to clean it right. I also learned like nappy changing, because I've never changed a nappy in my life. And we learned like all about different baby cries and why a baby cries, to get fed, to be changed, might need winding.
Yeah, I did feel better prepared after attending the workshop, because I was a bit nervous and on edge because I didn't really know much, because I'm only a kid myself, like, so you find out a lot of useful information, as I said, like.
Just stay in touch would be a good thing to do, you know, learn a bit more about it and that, instead of like sitting there wondering, worrying what's this, what's that, what to do and that. But yeah, it's a good help, like, because usually it's for the mums and that, but to see there's something for dads, it's good. It's good, like.
During the Hit the Ground Crawling workshop, a young father who attended in the past returns with his child. Here is one of our dads who talks about how the workshop helped him cope when his baby was born.
Since I've been to Hit the Ground Crawling, and now I'm a young dad myself and I've had my child, the main parts I've learned, like, how to use is like winding the baby, because that's the main like part when you're feeding the baby, because the baby might have colic and sometimes you don't know, and the only way you know is by like if the baby's crying loads. The main concerns about before I had the baby was whether I'll be a good father, whether I could do the things right, whether I'll know the things that I was meant to know. But going to the workshop, I've overcome all those fears. Like, it's made me a more confident dad. Like, just seeing my baby right now, I know everything that there is to know. Like, when she's either sick or like when she comes to me crying, I know everything that there is to do, because I learned to first aid if like she's in need, like if she needs help, like I know first aid, and that's what I learned on the course also. Yeah, I'd say like if you're a young dad and you think like this workshop might not be like good for you because you want the lads, basically you just got to think about it. It's your child, and you're going to do the best thing that you can do for your child is by knowing all the information that you can know. and going to the hit the ground crawling, I got to know every information I need to know.
Throughout Liverpool, children's centres offer lots of services for you and your family. They are set up for families with young children 0 to 5 years of age. Neil Thomas from Fazachley Children's Centre explains how they can offer support for your family.
I think every children's centre has different members of staff, but there's coordinators for the whole centre in the centres. There's family link workers, there's support workers, there's workers as well whose role it is to support any families who have children with any disabilities, and there's also childminder coordinators. But everyone within those have a designated area to support not just fathers but as well young fathers. Today in Liverpool we support young fathers with Hit the Ground Crawling. It gives advice and support for dads. We provide them with information about parent craft, ideas on sort of nappy changing, bottle feeding, breastfeeding. There's also an opportunity to reflect on fatherhood and what type of father they would like to be.
I'd say to them to come along to the workshops because it's really useful information, what they need to know, like, do you know what I mean? Some things they might think they know and some they don't, so either way you will get useful information out of short start, like.
It's good for young fathers to go to children's centres and helps them spend time and bond with the baby more. And it also learns them all stuff, how to feed them. I've done paediatric first aid. So if something happens to the baby, I know what to do. I've done football coaching and I've done a cookery course, so when she gets older, I'll be able to cook her food and being helpful because they can give you all stuff like safety gates and all stuff to protect the baby when she gets older. Door stoppers and that, and like cushions to put on the, like if you got a glass table or something to put on that. It's given me more confidence as a dad because I didn't think I'd have confidence at first. And it's given me advice on how to deal with the baby and how to play with it properly and what not to do with the baby. It's easier to be a dad now because if I've got nothing to do, I could just come to a children's centre instead of sitting in and doing nothing with her.
Sue Thompson is the specialist teenage pregnancy midwife at Liverpool Women's Hospital. Sue offers support through the workshop for young fathers, and she also offers support for the mums during the pregnancy, making sure that things run as smoothly as possible.
The young women's midwife. My role is specifically to look after young women aged under 18 who become pregnant and book in at Liverpool Women's Hospital. I look after them during the pregnancy, do the antenatal checks, make sure they're okay and their unborn baby's okay. Young dads are made to feel a vital, important part of the pregnancy, and their relationship with the young woman, you know, who's pregnant, is really important because they play a vital role in supporting that young woman, making sure she's happy and making sure she attends. My role within Hit the Ground Crawling is to provide a lot of practical information on the handling of a baby, changing of baby, winding of baby, feeding of baby, and as well as trying to prepare the young dads to be for the emotional and physical changes that will happen in their partner throughout pregnancy and following the birth of the baby. As long as the young mum-to-be is in good health and there's no complications during a pregnancy, she could deliver a baby at home if she wanted to. She could deliver a baby here on the midwifery-led unit, sometimes called the Princess Diana Suite, which is run by midwives. She could have a pool birth, we have a pool here, or she could go to the main delivery suite if she knows in advance she wants perhaps an epidural for pain relief. The young woman would be allowed to have 2 people with her when she's giving birth, and that would normally be a partner and, you know, perhaps a mum or a sister. They would not allow anybody under the age of 15 to be with her during labour.
When my girlfriend was having the baby and I was at the women's hospital, all the midwives were dead friendly, dead helping, dead supportive. If you were worried, the midwife will come over to you, explain like what was happening, wouldn't make you feel scared, wouldn't make you feel worried, they'll make you feel comfortable, let you know all the information that's happening. There's not one part that I'd say was bad about the hospital.
In this part of the DVD, you will find advice that will help you as a parent on health issues. You will hear from experts on sudden infant death syndrome, meningitis, shaken baby syndrome and fetal alcohol syndrome. Please take a few minutes to look at these sections as it is important for you and your baby as young parents.
SIDS is the unexpected sudden death of a baby. We don't know why babies die suddenly and unexpectedly. However, we do know that there are many things that you can do as a parent to keep your baby safer. What we recommend is that a baby sleeps in his cot, in the parent's bedroom, on his back for the first 6 months of the baby's life. We recommend that parents don't smoke around the baby and reduce or cut smoking completely during pregnancy. We also recommend that babies sleep in the feet to foot position in their cot so that they can't wriggle down under their covers and get too hot. We recommend that you keep your baby cool and you keep your bedroom or the sleeping area around 16 to 21 degrees Celsius, so you can use a thermometer in the bedroom. We also recommend that babies are breastfed. We would say that it's especially dangerous for babies to sleep on a sofa with a parent. That can increase the risk of babies dying suddenly and unexpectedly up to 50 times, so it's always best to avoid the sofa. It's safe to give a baby a dummy from birth. However, if you're a breastfeeding mum, we suggest that perhaps a dummy should be not given until breastfeeding has been established. And that can take up to about a month. So if you want to use a dummy and you are a breastfeeder, it might be better just to wait a couple of weeks until you're comfortable with breastfeeding. But it is safe to give a baby a dummy at any stage. No, if the baby settles to sleep with the dummy, it is likely that the baby will spit the dummy out in the night. It's not necessary to keep putting the dummy back in the baby's mouth during the sleep. We don't know why babies die suddenly and unexpectedly. Lots of research has been done and we still haven't got all the answers. However, we do know what can keep babies safer. So it's important that as parents, you follow the reduce the risk advice to keep your baby as safe as possible until a time comes when we actually do know why babies die suddenly and unexpectedly.
The symptoms in early stage meningitis might be very similar to other childhood illnesses, and at first your child might have a temperature, they might be off the food and they might be vomiting. But really the symptoms will very, very quickly be overtaken by the main prevalent symptoms of meningitis. And that might be that they might have very, very cold hands and feet, but they might have a raging temperature. They might be lethargic, they might be unresponsive, and they might be listless. Now, another sign of meningitis within a child would be a different cry. So if your child is showing a different cry or expressing a different cry, that's because they're in pain. They can't tell you if they're a toddler that they are in pain or if they are a baby that they are in pain. So they express that through a different cry, an uncomfortable cry. Now, when people think of meningitis, they tend to think of the meningitis rash. Now, that's basically septicemia, and that is blood poisoning caused by the bacteria. Just a pointer on that. A lot of people think that meningitis, you get the rash. Sometimes it doesn't always come. So you need to be looking out for those symptoms that I've said before. If the rash does come, it's usually the last thing to appear, and by that time the child is really, really ill. Now, if anybody knows anything about blood poisoning, it's basically very, very serious and it can take your lives away within a couple of hours. So you really do need to be acting. Now, if you spot a rash on your child's body, the best thing you can do is get a glass, put the glass on the rash. If the rash doesn't fade with the pressure of the glass, there's more chance it might be a septicemic rash. At that point, you need to be taking urgent medical action. The worst thing can happen is that your child be taken into hospital and it won't be meningitis. You could have saved their lives. If you suspect that your child has got meningitis, then what I would suggest you do is put them in the car, call a taxi, get them to the hospital as soon as possible. And don't be afraid to challenge and say, could this be meningitis? I know about the symptoms, they're showing these symptoms, could it be meningitis? Some children in hospital will sort of bounce back within a couple of days. Some children unfortunately don't and will sadly lose their lives. Kids these days are given immunisations built into the immunisation programme by the Department of Health. I can't reiterate enough how important it is that you follow that programme. Get down to your GP centre when you call, your health centre, and make sure your kids are given these immunisations against those 3 strains of meningitis. If you don't, your child could get them. They could die. It's as simple as that. So it's really, really important that when you get called for your vaccines, to take your kids down to the health centre or to your GP, that you go. If you don't get them, your child could lose their life. It's as simple as that.
When we found out that the baby had viral meningitis, they say that they get symptoms, but she didn't have all the symptoms that they say that you can get. Like they say that the baby can get a rash, but she didn't have that. It was just not feeding, not drinking, always sleeping, wouldn't move, just generally unhappy. Like the soft spot on the top of their head, they say it can be swollen if they've got viral meningitis or meningitis, but it mightn't be. Same with the rash, you might have the rash, you mightn't have the rash. So you know that your baby's generally not well, always take them to get checked out, because you never know. We didn't realise it was meningitis until the doctors actually told us, but we just knew that she weren't right. She weren't well. To us, she weren't well, she weren't a bubbly self. It's like normally she's trying to talk or she was trying to sit up, and she just basically couldn't be bothered. So we didn't know it was meningitis until we got to the hospital, but as I said, trust your instincts, because we knew she weren't well. So we knew to take her. It wasn't too bad. Like when we got into the older age, they checked her over and she was in there for 2 days on antibiotics, and after that she was fine. And my advice, if you know that your baby's not well, you get to the doctors, don't be afraid to ask the questions, because at the end of the day it's your baby, your child. You want to know what's going on, because they might necessarily talk to you. So you ask the questions, you want to know what's going on, and make sure you know what's going on, because that way it'll help you in the future.
Shaken baby syndrome is brain damage caused to a baby when they've been shaken. And that damage can be anything from something that is very mild right the way through to the most severe cases where in fact the baby could die. First of all, asking yourself, well, why is the baby crying? And the common ones, the common sense things, is the baby hungry? Is the baby uncomfortable? Are they too hot? Are they too cold? Have they got a wet nappy? Are they in distress? Have they got a bit of wind? And if you can deal with those things very simply, then usually the crying will stop. However, there are some times when the baby just doesn't want to stop crying, and it doesn't matter what you do, it just seems like the baby wants to continue to cry. And it's then when you start to feel tense, worked up, and that's when the danger is. When you start to feel tense, you start to feel like, I can't cope with this any longer, I'm going to lose it. Then it's perfectly fine for you to put the baby down in a safe environment, in their cot, lying on their back, as you would normally, and leave the room for a couple of minutes. And every now and then, go back to the room, listen, check, make sure the baby's fine, and if the baby's still crying, it's okay to leave them cry. Crying won't hurt the baby as long as the baby is not ill and you've dealt with all the other things that I've already mentioned. If the baby continues to cry for 15, 20 minutes, it's not going to harm them. So you can just keep going back, listen, come away again, go back, listen. And that's often quite effective, and the baby will quieten down and go to sleep. The golden rule is you should never shake a baby. And particularly a younger child, particularly under the age of 6 months, they don't have the neck muscles to control the rolling of the head. And so almost any shaking at that stage is going to be quite difficult for them to deal with.
Parents will need to make the choice between how to feed the baby, whether they choose to breast or bottle feed. There is a lot of advice there that they will be given in the antenatal period, and the information that should be given to them should enable them to make the right decision for them. And whatever parents do choose, then they will get support when they're in the hospital and then when they've gone back home with their new baby. It's very important for mums and dads to realise that breast milk actually gives the baby a huge advantage to fight infections when the baby's young. And even when the mum stops breastfeeding, there seems to be a longer period where the baby's protected. I think it's really important again that parents understand that formula milk doesn't have the antibodies, and that they will not be protected with the formula milk, and that's the real advantage of breastfeeding. But the clear message is that if a mum can just try and breastfeed, then even given a small amount of colostrum, and that's the first milk, will actually be beneficial to the baby. Even if she only manages to feed for a few days, she's done really, really well. Mums and dads should start considering how to introduce solids to the baby at around the 6 months mark. If you give your baby solids earlier than this, then they usually aren't able to actually swallow the foods and also to digest them. So there's no hard and fast rules, but around the 6 month mark is about the right time. And if you try and do it earlier, the baby probably won't want it. And it just gives you time to actually enjoy your baby rather than worrying about making all the foods too early. So around the 6 months is the right time.
Fetal alcohol syndrome is created by the birth mother drinking alcohol in pregnancy, and what it actually causes is a level of birth and physical defects in the unborn child. Fetal alcohol affecting disorder is a new name now, which encompasses FAS, which is fetal alcohol syndrome. Only the children with fetal alcohol syndrome are the ones with the dysmorphic features, but then we've got a wide range of children that are damaged in alcohol through the different stages throughout the pregnancy when alcohol is consumed, giving again a wide range of disabilities, which are mental and physical. There is no known safe amount of alcohol that you can consume in pregnancy. There are no two women the same. It all depends on your lifestyle, your culture, and whether you're taking any other toxic substances. The only thing you could do is play Russian roulette with your developing fetus. A young father can support his partner by not drinking alcohol if possible during pregnancy, and not taking her to places where alcohol is consumed. And basically it's only 9 months for a positive outcome. Nil is the only way forward.
Anytime I think that I can make it on my own, I just wake up and realize it was a dream. 'Cause I can't go about without the love that you give out. It just keeps going on and on.